Good morning. I'm Berks County Commissioner Christian Leinbach, and I want to welcome you to our Berks County Operations meeting for September the 24th. We are both in person and broadcasting live via Microsoft Teams live event. And at this time, I'd like to recognize my executive assistant to read the public comment policy. Anne Marie?
Thank you, Commissioner Leinbach. Public comment will be accepted in person and through the Q&A function, Please include your first name, last name, and municipality for all comments. Any comments without name and municipality will not be considered. Sorry. Each citizen can submit one comment. Comment length is dictated by limitations of the platform being used. In-person comments will be accepted first, followed by comments submitted virtually. The meeting comment period is limited to a total of 30 minutes, including both in-person and virtual comments. This time period may be extended at the county's discretion. Please be concise. Comments that are germane to county business will be read during the meeting and should not be considered to be interactive dialogue. The county shall be the final arbiter of whether a comment is germane and should be read. Any response to public comment will be done at the county's discretion.
Thank you very much, Anne Marie. Are there any additions or corrections for the September 10th meeting minutes? Hearing none, the minutes will stand approved as presented. There's no public comment on agenda items in person and nothing online. So we will move right into our agenda. We have two items on the agenda today. One deals with employee benefits, and that's coming through our HR department. And the second one is dealing with Connections Works and our Berks County Jail. That will be presented by Peggy Kirshner, but we also have Warden Jeff Smith here. I assume you'll be weighing in on this as well. So we'll move right into our program. I'm not sure. I'm just going to go right to our Chief Human Resource Officer, Jess Weekneck, and let her lead off this first segment. Jess.
Okay, great. Good morning, Commissioners.
Good morning.
So I can't believe we're here a year later already talking about 2025 employee healthcare benefits, but we are. So with that said, Pete Cahara is here today with McGriff to go through the presentation on our recommendations moving into 2025.
Thank you, Jess. Good morning, Commissioners.
Good morning.
I don't know if the electronic presentation will be up on the screen, but I think everybody has a hard copy. So today what we plan to go through are our recommendations for, thank you.
Is he bringing it up? Okay.
Got it. All right. Well, while this is coming up, we'll go through the 2025 recommendations. But before we do that, we do want to talk about in 2024, last year at this time, there was a big decision that the county made for the 2024 plan year, and we just wanted to talk through the impact of that. And that was in 2024, the county made the decision to exclude non-diabetes weight loss drugs in 2024, as most employers were doing, making sure that coverage continued for those with diabetes, but those that don't have diabetes, the cost of these drugs, while effective, was something that a lot of employers had to weigh. The impact on the county. So in 2023, the cost of these drugs were on a path towards doubling in 2024, from around $2 million to just shy of $4 million in 2024. As a result of the changes that the county made, there's been $1 million reduction from 2023 to 2024. And had you continued down the path of covering these, the expectation would have been a difference of nearly $3 million. So while we recognize that was not an easy decision for the county, it has afforded the county to continue offering very generous benefits to all of your employee population. And we'll talk about that on on slide 3 of just how your benefit plan design compares to benchmark. But we also wanted to include on slide 2 just some objective statistics around the weight loss GLP-1s, that the real world evidence of these drugs has not met the level of the clinical trials of these drugs. The clinical trials very positive results. While the results are positive, the real world results have not met the level that the clinical trials have yielded. Beyond that, the sort of quit rate of folks taking these multi-$1,000 drugs per month, about 20% of members over the last 2 years, and this is across Pennsylvania, New York, West Virginia, and parts of Delaware. 20% of members had discontinued therapy within the first 2 months. 40 to 60% of members discontinued therapy at 1 year. So it felt important to share with the county where you are today and how that has fared relative to the industry at large.
If I could weigh in, I remember this discussion distinctly. We had some individuals, some staff come forward and express concerns that we were moving to a direction we weren't going to cover it. And I think the commissioners, along with HR and McGriff, did a very deep dive. And some of the things that came out, you've alluded to them, and I just pulled up the latest articles, and what you're seeing is one, there is significant evidence that when people on weight loss drugs get off the drug, they go back to where they were before, some cases even worse. Side effects are much more significant than what were presented early on. And when we talk about side effects, very, very serious potential side effects. And at the end of the day, we have a responsibility, not just financially, but if we're going to cover something that people are utilizing and we become aware that there are significant risks, we have to address that as well. And we did that last year. If you remember, we didn't have a lot of this data, but there was some preliminary data on both of those areas saying, wait a minute, even though it's very short term, it doesn't appear that this is a long-term solution. Everything I read says, once you stop, your diet has to change and you have to exercise. This isn't some cure-all that's fundamentally changed your DNA structure and now you're able to eat whatever you want, do whatever you want, and have a perfect scenario. So while the savings is important, my concern at the time was, were we losing an opportunity to help our employees with a legitimate health need surrounding obesity? And I'm more convinced today than I was even at the time that we made the right decision. And I think there's a lot more that you'll be seeing coming out of this area. I actually wonder if some of these drugs may get some stricter FDA regulation, because technically these drugs were approved for diabetes, not primarily as a weight loss drug, but they are in heavy use now in the weight loss industry. Is that fair? I don't want to say something
Absolutely
that you don't agree
That's
with.
fair. Yep.
Okay.
I think everything you mentioned is accurate. So if and I don't know if
Who has
on the screen.
a copy of the presentation? Can somebody send it to me? I can bring it up and we can get Pete through this. Okay, because I looked, it's not on my. Who's it from? Amanda?
Sending it.
Oh, she's sending it right now. Just give me a second. We'll bring it up and we'll get you right on track.
All right. if I could sing or dance, I would, but I can't. So.
Like a library right now. Did you send it? There it is. Sometimes takes a minute here to get through. Okay, I'll bring it up.
All right. So we're on slide 3.
Okay, let me go in here into presentation. It's a PDF here. Slide 3.
Okay. So as we look forward to 2025, I think it's important to highlight that the county offers a very generous health plan. It's very competitive, and that's important in attracting and retaining employees and their family members that work at the county. So while you continue to offer a generous health plan, there's always the balance of what's the financial implications of that, how to manage against the 7, 8, 9% healthcare trend that's expected and projected into the future. So the bottom slide shows what's highlighted in green is it's the County of Berks health plan design, some key features of the design, and how it compares broadly to a couple of different viewpoints, just government entities nationally, McGriff's book of clients nationally, and then more Eastern Pennsylvania. We're sort of labeling that as Lehigh Valley. But in each of these areas, your deductible levels of the health plan have remained at the point that they are for as long as we've been partnering with the county, and continue to be very, very rich, very generous, very competitive. Similarly, the cost of going to a primary care provider, a specialist, and the copays associated with the prescription benefit that you offer continues to be competitive and generous. So I think it's important to make note of that ahead of some of the considerations for 2025. Part of our job in partnering with you is to just keep you eyes wide open to what are the options that the county has to consider, what are some of the other things going on in the industry, so that you can balance employee impact, organizational impact, and financial impact. So if we move to the next slide, we've summarized the four primary options of consideration for 2025. The expectation in 2025, based on a number of publications, is that healthcare inflation is expected to be the highest that it's been in 13 years. A lot of that is driven by the cost of labor in the healthcare for healthcare workers, but also as new technologies, new treatments are coming up, new prescription therapies are coming out. All of those factors go into what the expectation of costs are in the future. So going through each of the four options from left to right. So the first option yields the most savings with the least employee impact. And we tried to give a description summary, show what is the estimated employee impact, and then show the savings projection to help in the balancing. So the first option would be updating the formulary to offer a more narrow formulary or list of the drugs that are covered across all therapeutic classes. So rather than multiple brand drugs being available for a particular therapeutic class, CVS identifies what are the primary brand drugs that would be available, and there might be some that would not be available. That is the list of drugs. Today, you have an open formulary, a very broad formulary or list of drugs. In the narrower formulary, there's a more narrow list, but there are drugs available for all classes of drugs. As a result of that, there are around 123 members of your roughly 3,000 members that are covered under your health plan that would be impacted and would have to change the drug that they're taking in order to continue coverage into the future. The savings associated with this narrower formulary is $718,000. Option 2, there is a high-cost drug subsidy program called Prudent RX. Prudent RX partners with CVS. And it's a concierge program that enables members and the county to leverage available manufacturer assistance subsidies for eligible higher cost drugs. So there are the manufacturers of some of these higher cost drugs have additional subsidies available when those are taken advantage of, and that's what the Prudent RX program represents. There are approximately 68 members, so less than 5% again of your covered population that would be eligible for these. Their cost share, what the copay they would pay, goes down to $0. But it also, there's a subsidization that supports the county cost as well. So it's a benefit to both the member and the county. The savings associated with that initiative is just shy of $400,000. Option 3, this is where we get into more employee population impact. So there's a lot of discussion around steerage in healthcare and going to certain providers that have lower cost, and higher or equal levels of quality. So there is a narrower network, and we've talked about this in previous years, but you can offer a benefit design that maintains the current plan designs that we talked through on the prior slide. So the $250 deductible, for example, so long as your members go to a certain set of providers. So the Penn State Health, for example, is one of those high-performing network providers that both Highmark and Capital Blue Cross have identified in their narrower network. And then while people can go to Tower Health or other providers as an in-network provider, there would be a higher deductible associated with that. It is a program that not every employer feels comfortable with offering. It would impact more than 50% of your enrolled members. There are about 1,500 members that utilize the Tower Health system. But as a result of the higher levels of discounts that Highmark or Capital have with the other providers that they would steer towards, that is what drives the savings associated with this initiative.
Several years ago, we had discussions around a similar model, for lack of a better term. If we went this direction, wouldn't this at least challenge Tower Health Reading Hospital to negotiate with the county based on the size of our operation on rates? Or would it automatically be published rates, and as a result, we're sending people to Penn State St. Joe's?
It would influence the conversations that they're having with your claims administrator. If it's right. Capital Blue Cross or Highmark, how that would influence what their when their contracts are up for renewal, it would influence those conversations.
Yeah, some of the challenges, this is not new. I don't see, Kevin's not here, but I think very early on in my first term, this came up, capital came to the county, and we actually had a discussion about a plan that made Reading Hospital out of network because of how serious the challenges were. The flip side is there's a lot, and I'm not being critical of Reading Hospital, but there's no question that on some of the most common procedures, there's a significantly greater cost. But there are also significantly greater assets available and procedures available at Reading Hospital Tower Health than there are at St. Joe's. Penn State St. Joe's is a much more limited area. We do have St. Luke's kind of moving into the area and Lehigh Valley up in the Northeast. But I think that's the other concern around this model. I'm not anti. The other question that comes up, can you take option 3 and option 1 and put them together because they're two completely different things and potentially be looking at, you know, 1.5 to close to $2 million in savings?
Any one of these can be pursued independently or
Okay.
or together. To that point, in balancing the employee impact and part of the bottom portion, it's similar. Option 1 and option 3, similar level of savings, but very different percentage of employees that would be impacted, and that ultimately is the county is weighing its options a point of consideration.
So I have a question here. When you're looking at the option here and it says maintains the current plan for a specific set of providers and increase cost share deductibles and copays for other providers, and you're looking at here at a savings of $818,000, what is the difference in deductibles and copays from, say, a Penn State to a Tower Health or to another provider?
Yeah, we have that on slide 7 in some of the supporting detail. We show what the assumption is, the underlying assumption of the plan difference. So instead of a $250 deductible, somebody that would go to Tower Health, for example, or Reading Hospital, it would be a $500 deductible. Once that person meets the deductible, there would be a 20% coinsurance, so they would pay 20% of cost thereafter until they hit the out-of-pocket maximum if they continue going to Reading Hospital or Tower Health. Whereas the county covers 100%, the member pays 0% after they hit the deductible if they continue going to Penn State Health, for example.
So it could be, for some people, it could be significant.
Mm-hmm.
Yes.
Okay, thank you.
Yep.
I'll take you back.
Okay, thank you. And then option 4 is more it's similar idea, but it's sort of on the farther end of the spectrum. So offering a high deductible health plan that is eligible for a health savings account. The IRS dictates what the minimum level of deductible is, which in 2020 today it's around $1,600. So it's significantly higher than what the deductible is today. But just showing that if you were to offer one of these plans either as a full replacement or in alongside of the current plan design you offer. So if you were to offer the $250 PPO and then the qualified high deductible health plan, the savings associated with it is a function of how many people would enroll in those plans. And how many people would enroll in those plans is dependent upon how much it would cost to. So if people are taking on more than $1,000 of deductible, they'll probably want to make sure that they're paying $100 less each month or saving a similar amount of what additional deductible they would be taking on. Because the county offers a very generous health plan from a pricing perspective of what comes out of the payroll deduction. That is one key consideration, that offering a high deductible health plan like we have in option 4 and like we outline in the supporting detail. If everybody were to enroll in that plan, there would be upwards of $5 million of savings associated with that. But again, it would impact 100%. If everybody enrolled, that would be an impact to 100% of the population that enrolls. And it's balancing that. You would move away from being more competitive to less competitive if that were the only plan design. So it's something that, again, part of our responsibility is to make sure that this is a point of discussion and a consideration so that you have the facts and considerations to work with.
Pete, a couple things. One, make it very clear for people maybe outside of the county, we have one plan. So the commissioners are sitting here, we're on the exact same plan that our employees are. The only exception would be union. I think Teamsters may have their own. And if somebody is on a spouse's insurance where the county isn't providing it. So we're all talking the same thing. Currently, we have an FSA, not an HSA. And there's dramatic differences between an FSA. There's a lot more. FSA is very restrictive. HSA has a lot more options. Could you simply delineate the difference between an FSA and an HSA? And the reason I say that, if I had to work the high deductible plan with an FSA, I'm not even going to look at it. But an HSA is very different and changes some of the opportunities for the employee. Can you share the differences?
Sure. So an HSA can only be offered alongside a qualified high deductible health plan. So there are plan design requirements associated with a health savings account, whereas an FSA, there are no plan design requirements associated with offering an FSA. A health savings account is an employee's account. So if you put money into the health savings account, it's yours in perpetuity until you use it. For an FSA, if you don't use or exhaust those funds that you put into it by the end of the year, some of it can roll over into
500 can roll over.
But it for all intents and purposes, it's more a use it or lose it. And if you were to leave the county, you would not retain that FSA. Whereas if you were to leave the county and have an HSA, that HSA is yours wherever you go.
In the FSA, traditionally, it's the employee's money that goes in. So the end of a year, looking at the following year, you do a selection from 0 to, is it 35? $3,200, $0 to $3,200. You need to guess pretty well, because if you come back and it's December and you have $1,000, you got to figure out how to spend $500 of eligible expenses between then and the end of the year. Otherwise, your money, I don't know whose money does it become?
The county's. It has to be redistributed into the health and welfare plan, but it becomes
an HSA. You can accrue that money, and that money remains yours. You may think you need to put in extra money because of something you're dealing with, and things change. It ends up it's not as serious as it was. You don't have to worry about what do I do with that money now that I made a decision to put that in. The other aspect is in an FSA, I believe I'm correct here, the employer doesn't put money into that. In some cases, HSAs, an employer will put a flat sum of money into the HSA at the beginning of the year, recognizing the high deductible nature. And the reason the employer does it is because in the end, it still is a tremendous savings to the employer. And they do it to let the employee know, hey, look, I'm putting in 50% of your deductible, or I'm putting in 100% of your deductible. That money is yours. So I don't know what you've put together here, but are we talking comparable differences between the FSA we have and an HSA you're looking at here?
very different from the FSA and the HSA. The assumption in option 4 is that you would not, as an employer, you would not put any money into the HSA. So part of the consideration
Okay.
would be, would you use any, you could make it a cost neutral type of scenario where if you were to fund the HSA, it would reduce the amount of savings, but we wanted to show what that potential could look like if you were to just offer the plan to make it HSA eligible and let the employees decide if they want to contribute to it or not.
And again, you could do this 2 different ways. You could say we're switching, and again, anybody listening, I'm not recommending that, but we're switching and we're going from where we are right now to everybody is going to be on a high deductible plan. But is it not also correct that this could be an option that employees could choose, which would give them the opportunity to say, okay, I can stay with what I have, or maybe a variation of it. I can stay with what I have, but let me investigate this high deductible plan and see if in the end that might be better for me than what we already have. Is that an option?
That's an option, and the consideration. So today, if somebody's enrolling in employee-only coverage for the plan that you have today that has a $250 deductible, it's approximately $50 a month. So over 12 months, people are paying about $600 for that deductible. The consideration would be if you offered a plan that has a $2,000 deductible as HSA eligible, you're taking on as an employee more than $1,700 of additional deductible exposure. Even if you made that coverage free for the employee to enroll in that plan, they would save $600 a year out of payroll deductions, but they'd be taking on $1,700 more in deductible. So that's the biggest consideration of how do you set the payroll deductions so that that the potential exposure for an employee enrolling in that plan is worth moving away from the plan that they're enrolled in today.
Do you have any idea, you say up to $5 million in the high deductible plan, is this based on about 2,000?
This is based on if everyone that's enrolled in the plan today, if they were to, correct.
But let's just to get comparison, is the high deductible based on a number somewhere around 2,000?
Yes.
Okay.
It is.
What would happen is,
I'm sorry. The assumption is about $3,000 deductible.
3,000. Okay.
Correct.
What would happen if you don't know the answer, it's fine, because we're not putting you on trial here. We're just trying to get some good information. Whenever we talk about the possibility of changing healthcare for employees, many employees get very concerned. Some of them, might be in the middle of some type of health crisis and wondering what impact it will have on them or their family. And we get that. That's the reason I'm asking questions here. But if we offered this and the county took on 50%, in other words, we said we're going to put 50%, 1,500 of that 3,000, or we're going to put all of that in, what impact does that have to the bottom number? And if it's something you want to go back and look at, I'm fine. But I think it's important to know that, especially if we offered this as an option that people could look at.
I don't know that answer. We'd have to look into that. But here's a consideration. If that were offered in addition, what the risk there is that if you have somebody that doesn't use the health plan, so technically they're $0 per year. If they enroll in that plan, if only the lowest healthcare utilizers enroll in that plan, well, all of a sudden you're giving $1,500 to folks that aren't even using the plan to begin with. So it would actually have no impact on what your healthcare costs are, but you would be putting out more money. It would actually be
and taking more
increase.
risk because we're self-insured.
Correct. And that is the risk of offering 2 plans as opposed to 1, because if only the lowest utilizers go into that plan, then it has almost an opposite impact of expectation.
Okay.
Because we are self-insured, is there any benefit of offering 2 plans versus 1?
For those that, depending on what the cost is, if it's a lower cost option, a lot of nationally, when offered two plans, people will generally overinsure themselves. So it's like if you were getting insurance coverage for $1 million home, but you only had a $200,000 home or a $100,000 home, you wouldn't need that extra coverage. There are some folks that just go to their primary care physician once a year. They get their annual preventive visit. They don't need the level of coverage, or they don't anticipate they would need the level of coverage that is available to them. So they would prefer to spend less out of their paycheck to get a higher deductible and sort of pay later if they need to use it. So,
But to the county, would there be any benefit in doing that?
to the extent that an employee is saving money for themselves and getting a plan that is better meeting their needs, and especially if they could put money into an HSA, if that's of value to them, that would be the value to the county. From beyond that, it's more, what does it mean to the employee in enrolling in a plan that is best suited for them and their personal needs?
Okay, thank you.
You're welcome. So again, we wanted to give you a full range of some key considerations. What we have on slide 5 is for consideration each year when we work with the county and of projecting what your budget would be in 2025 and what employees would pay out of their paycheck. If you were to pursue none of the options shown on slide 4, the projected increase in your premium equivalence is 9.5%. Last year it was about 7%. The year before that it was 18%. So you're looking at a 9.5% increase in premium equivalence. Employees pay 8% of those costs if they complete the wellness program, and those that don't complete the wellness program pay 10%. And that's absent. There are some collective bargaining arrangements that might vary from that. If the bottom table on slide 5 shows if you were to pursue option 1, and we just showed option 1 because it is the highest level of savings with the least employee impact. That would reduce that increase from 9.5% to 7.2%. So we wanted to show this illustratively for purposes of today. But certainly any of those options are a possibility for the county.
Can you just re-explain for me option number 2 here, the high-cost drug subsidy program, and how would that impact a county employee?
A county employee that is taking a drug that is targeted for the high-cost drug subsidy program would go from paying the copay for a specialty drug or a brand drug. Their copay would go down to $0. And the county benefits, so they have to enroll in this program, and Prudent RX, the concierge program that works with CVS and the member to enroll the person in that program, their cost share goes down to $0, and the subsidy for those drugs ends up benefiting both the member and the county. So for example, if there's an injectable drug that is $3,000, and if the employee is paying $50 copay for that $3,000 drug, the county is picking up $2,950. Enrolling in this type of program, there might be a manufacturer assistance program that provides $1,000 subsidy. So that drug goes from $3,000 to $2,000. So the member in that case is paying $0, and the county is picking up the full $2,000, which is lower than the $2,950 that the county was picking up absent that program.
And what is the downside of that option to both the employee and the county?
The member has to take the call from the Prudent RX program and enroll in that program. If they are opposed to that in any way, I mean, that they would be able to continue taking that specific drug. But the downside is if they refuse to enroll in that program, then there is a 30% coinsurance that they would pay instead of paying the $0.
So is that similar if you get a prescription now with RX benefits and it's not covered, but you have the prescription? One of the options you have currently is you use your FSA, or if you're out of your FSA, you pay whatever that cost is. That wouldn't change here. If somebody had a particular prescription and what did you say? It's not Prudential.
Prudent RX.
Prudent RX said, that's not in the plan. In lieu of that drug, this is the drug that we cover. And the person says, I don't want that. I want the drug that I have. They're going to have to pay out of pocket. Is that correct?
Correct. But Prudent RX is not changing the drug that the person is on. They're identifying if a person is taking a drug that qualifies for those manufacturer assistance
For the
programs.
manufacturer rebate.
It's you will continue to take this drug.
Has nothing to do then.
Has nothing to do with changing the drug that they're on.
Very good point.
The formulary change, the option 1, that is where a member could be taking a drug and they would have to take a different drug if they're one of the 123 members of the 3,000 members.
So we have a question that I think normally we'd wait till the end, but this is appropriate right where we are. And the individuals in the room, Heather Berger, Hamburg, in that example, must drugs be purchased through CVS and delivered by mail, or may the employee use a regular pharmacy? Good question.
That's a great question. And when I say, and this is the tricky, CVS is your when I'm saying CVS, that's your pharmacy benefit manager, regardless of what brick and mortar store you might go to. Most of these types of drugs are mail order, and they're not readily available at any retail pharmacy that you go to. So they're higher cost, more specialized in nature. So it does not require you to go to a specific retail pharmacy setting.
Good, thanks for picking that up. Go ahead.
So that concludes what we plan to cover. Again, wanted to go through the options of consideration and show what the financial impact would be if you were to move forward with option 1, for example.
Thank you very much, Pete. Before we end this segment, HR and Jess, put you on the spot. Is HR in a position to have any kind of recommendation, or what do you see as the next steps? I think we're fairly tight on time here because of the budget process and the end of the year.
Yeah, so we're looking for a decision in the next 2 weeks. That way we can prepare for open enrollment. In our opinion, option 1 and 2 are most definitely, I think, a good direction to go for the county.
Okay. I'm thinking in order to do this in the next 2 weeks, I think it would be valuable to put your recommendations in writing to the commissioners. I'm curious about the high deductible as an option, not as a replacement. Just kind of look at that. And what I hadn't thought of until the very end of that discussion is the impact it might have on a self-insured entity versus a traditional business that is not large enough that self-insurance makes any sense. But I kind of would like to look at that. Secondarily, let's put it, if we can, talking to my colleagues, I think we need to put a time limit that we're going to make a decision by a specific commissioners meeting where we're going to have it on the agenda. And between now and then, we need to get the information and make decisions necessary. Does that work?
Yep.
Christine, put you on the spot. Is this executive session material or is this going to be one-on-one HR commissioners?
One-on-one conversation.
Okay, good. So does that work for you, Jess?
Yes.
And I want to thank Jess and Wendy is our benefits coordinator for HR. Appreciate that. And Kristen Scheffler. I know this is more complex than normal. And I do appreciate McGriff. Year after year, we say this, or at least my experience, McGriff is the first healthcare consultant that we've had that has been worth it. We struggled with multiple.
Thank you.
We struggled over multiple years with limited to no value. And I know Christine was aware of a lot of that and some in HR, but you've done very well getting us information and digging deep when we've asked for that. So, okay. Anything from my colleagues before we move on?
I just have one more question. If we were to offer option 4 for those who would want it, would that put any type of what impact would that have on the county in reference to having, if you would, 2 different types of insurance for payroll deductions and everything else that gets done back office?
I think from a union perspective, that might be a separate question without a material change to what people are paying for the PPO 250 plan that you offer today. There's a likelihood that you might have nobody that would find it worthwhile to take on the risk of a high deductible health plan.
Good question.
And I think from the perspective of payroll, I don't really see that being an issue with the deduction portion of it.
Okay, thank you.
Okay, thank you very much. Our next presentation is from Connections Work. Peggy Kirschner and Nikki Schnabel, as well as our warden. And I'm trying to figure out what's going on here. Is this where I say in this corner? People who are watching can't really tell what I'm referring to, but the warden's is standing up and he's at one microphone. And a separate microphone, we have co-executive directors of Connections Work, Peggy and Nikki. So I'm going to let you guys lead. Are you leading off?
I'm just going to kick this off real quick.
Warden.
Good morning. Last
Morning.
spring, Connections Work hosted a reentry simulation. It was an eye-opening experience for many of us. I got firsthand understanding of the barriers that the reentrants face with employment, housing, education, and just basic needs. I left there feeling that we need to make a smoother transition from incarceration to the community. Shortly after that simulation, the jail began to explore areas that could be improved upon. I'm pleased to report today that we've increased the supply of medication upon release from 3 days to 14 days. We're working with PennDOT to increase the access to obtain state IDs. And we're also working to streamline the process for medical assistance before the release. These projects are something that we have been doing in-house at the jail. But let's look at the current programs like Reentry Resource Center, Reentry Works, and Working Towards Change. These all benefit the reentrants, their families, and the community. These programs would not be successful without our continued partnership with Connections Work. The jail and Connections Work have worked together to identify some areas where we believe enhancements may be possible. We'd like you to consider a couple suggestions. Ladies.
Good morning. Okay, sorry about that. I didn't notice. Good morning. I am Peggy Kirschner. I'm a co-executive director at Connections Work, and my Nikki Schnabel, will be a co-presenter. I would like to take a second to thank the Board of Commissioners for the opportunity to present our proposal today, and for your support of Connections Work programs. Your recognition of how vital it is to provide justice-involved individuals with the resources and opportunities necessary for stable, successful lives is truly appreciated. In addition, I'd like to thank the administration of the Berks County Jail System, specifically Warden Smith and Deputy Warden Smith, for their partnership in our current programs and services within the jail, and for their commitment to collaborating with us on this proposal to address the needs of those incarcerated at the Berks County Jail System. Berks County is fortunate to have leaders who understand the importance of serving this very marginalized population. Connections Work is Berks County's leading provider of reentry services. We've been in existence since 1975, and reentry workforce development has been our core competency for the last 15 years. Our first foray into reentry workforce development began in 2010 when we were asked by the county to help design and operate the county reentry program. We continue our involvement to this day and work closely with the administration of the jail on this initiative. Since 2010, we have leveraged our expertise to bring hundreds of thousands of state, federal, and private dollars to Berks County to expand our ability to serve the justice involved and impact thousands of Berks Countyans. In most cases, we have secured ongoing funding that allows us to sustain programs for specialized populations of the justice involved, like those with an opioid use disorder, those with serious mental illness, and participants in the county's treatment courts. We are here today with a proposal that will allow us to sustain two important programs that will end if our proposal is not approved, and to expand the impact of our current program mentioned earlier at the Berks County Jail. Our proposal will allow us to sustain and enhance the coordinated system of reentry services in Berks County that Connections Work has strategically designed and implemented over the last several years. As a nonprofit, we are able to provide this robust offering of services in an efficient and cost-effective manner, impacting not only thousands of justice-involved residents of Berks County, but their families and the community as a whole. Before we get started with the proposal, I wanted to highlight the need for these services. When you look at the statistics shared on the slide, it's obvious that the scope of the problem requires an equally substantial response in order to ensure successful outcomes. We know that there are approximately 8,000 individuals living in Berks County who are under some type of court supervision, and tens of thousands more who are off of supervision, but living with a criminal record. Having a criminal history, no matter how removed one is from the time of conviction, raises over 40,000 barriers, including employment, housing, education, and access to basic needs. Prior to the development and launch of our programs, there were no targeted resources and services designed to meet the myriad needs of the justice involved. Our coordinated approach to reentry involves three programs: the Reentry Resource Center, Reentry Works, and Working Toward Change. Our proposal seeks to continue the Reentry Works program at its current capacity and enhance our Reentry Resource Center and Working Towards Change programs to include additional staff to increase the scope of our services at the Berks County Jail System.
After hearing about the number of individuals affected and the scope of their needs, ensuring a smooth transition from incarceration to the community is vital. Those of you who were able to take part in the reentry simulation last spring experienced this firsthand. The Urban Institute of Justice Policy Center noted the importance of the first hours and days of an individual's release from incarceration in their research report, Release Planning for Successful Reentry. The report, based on national data, notes that without access to food, clothing, shelter, transportation, personal identification, and other key necessities, former inmates may see no other option than to return to illegal activities in order to meet their needs. Their findings align with what we have seen locally and represent the interconnected challenges that, if not addressed by the essential services and support provided only by Connections work, can lead to instability and eventually recidivism. Our Reentry Resource Center, which began operating in 2021, is designed to address these critical needs through support, referrals, and resources to individuals transitioning out of jail, those recently released, and to justice involved living in the community. We offer a walk-in center of resources that help people navigate the local social service system to secure basic needs and access needed services and behavioral and physical health treatment. This is accomplished through information, referrals, warm handoff to other social service providers, and the provision of support services. We also provide the funding needed to acquire the critical items needed to ensure success in employment, such as IDs and transportation. Our reentry resource coordinators also developed and regularly update our reentry guide to services, which contains pertinent information on services in the community and how to access them for use by reentrants and other social service providers. The Reentry Resource Center was originally funded in 2021 through a one-year COVID response grant from United Way. Over that grant period, we demonstrated the need and demand for this type of service, so we applied for and were awarded a 2-year Justice Assistance Grant from PCCD to continue the program and expand it to add a position to enable us to start working with inmates at the jail prior to their release. This jail-based position has proven to be successful at preparing individuals for release, and the need for an additional position at the jail has been evident, as the demand for the services is more than one position can meet. Our proposal seeks to continue the program with an additional FTE so that we can increase the number of individuals that we are able to work with prior to their release from the Berks County Jail System. In 2023, we served 823 individuals, and from January through July of this year, the Reentry Resource Center has served 529 individuals, so we are on pace to exceed the number served last year. If our proposal is not approved, this program will end December 31st of this year.
Reentry Works is a workforce development program that we launched in 2021 with 3 years of grant funding from the United Way, Berks County. We developed Reentry Works to fill the gap that existed in the county for services for the justice involved. As I had mentioned earlier, we had grown to serve several specialized populations, but there remained a large population of individuals not eligible for our services. Reentry Works provides a robust, opportunity-rich program that fosters stable employment for individuals with current or past involvement in the criminal justice system. The program prepares individuals for success in the workplace, provides career pathways, and connections to employment opportunities, as well as retention support. Reentry Works leads to an increase in stable employment for this marginalized population, which in turn leads to increased income and stability for individuals and their families. In addition, an individual's chance of ending up back in the criminal justice system is reduced. As I mentioned earlier, reentry workforce development is our core competency. In addition to case management and employment preparedness, Reentry Works offers individuals the opportunity to use our computer-based learning center for job search, resume development, career exploration, and to complete assessments to determine literacy and numeracy levels. They also receive financial literacy and digital navigation education, and we have in-house ESL, adult basic ed, and GED tutoring provided by the Literacy Council. In addition, we have an employment development team that establishes relationships with local employers to provide education on the benefits of hiring individuals with a criminal record and to connect them to our robust pool of talent to help them meet their hiring needs. Those we serve are provided retention support and continued case management after landing a job. Primary referral sources for this program are domestic relations and adult probation, and also include many other social service providers and justice system entities. In order to ensure that the program is reaching as many individuals as possible with no built-in barriers to involvement, we conduct outreach in the community and allow individuals to walk in and receive services. As a matter of fact, the majority of individuals served in Reentry Works have come to the program on their own, seeking assistance because there is nowhere else for them to go to have their needs met, and that has a network of employers who are willing to hire them. In 2023, we served 372 individuals in Reentry Works. From January to July of this year, we have already served 384. From January to July of this year, we have had 2,653 visits to our office for this program alone. Of those that are ready to work, 66% are maintaining employment. To highlight the pervasiveness of the need for assistance finding employment among this population, we took a look at the incarceration history of those we have served in Reentry Works. 26% had not served any time at all. 31% had been released within the prior year. 23% were released within the previous 2 to 4 years. And 20% had been released within the previous at 5 years or longer. The need is consistent, and it is not greatly reduced by the passage of time. As we mentioned earlier, there is no planned growth for this program. Our proposal is to continue the program at its current capacity. If our proposal is not approved, the program will end on March 31st, 2025.
The third component to the coordinated reentry program is our Working Towards Change program at the county jail. This program has been funded collaboratively by the United Way of Berks County and the County of Berks since 2010. This program allows for a continuum of care from the jail into the community. We provide case management, both pre and post-release, to a segment of the population in the Berks County jail system. Individuals are selected for inclusion in the program by the treatment department at the jail based on the results of their risk needs assessment. Our reentry case managers complete a barriers and basic needs assessment with clients while they're in jail to help them identify needs and prioritize targets for change. The client and their case manager work together to prepare for successful reintegration by developing a release plan, setting goals and objectives, and identifying the resources needed to achieve them. Post-release, clients continue to work with their case manager to address any immediate needs, such as housing, ID, food, clothing, and medication. They complete an employment curriculum, including resume building, interviewing skills, proper job search, completing applications, financial literacy, and job retention. All participants have access to the computer-based learning center, as well as employment opportunities cultivated by our employment development team. From January through July of this year, we have served 101 individuals pre-release and 68 individuals post-release. While our jail-based program has been very effective, it only serves a fraction of the jail population. In order to maximize the county's return on investment for this program, we worked with the warden and deputy warden to develop this proposal, which seeks to expand and enhance the program by increasing our capacity to serve more individuals pre-release, while also providing a higher level of service to those closer to their release date. We are also proposing to include an evidence-based cognitive interventions group proven to reduce recidivism. In order to accomplish this, we developed the following phased approach to accommodate the expansion. We currently have 3.75 FTEs working in this program with an annual capacity of serving 173 individuals. Our target with the expansion is to serve 460 individuals in 2027. And in order to accomplish this, we are proposing to add 2 FTE reentry case managers in 2025, 2 FTE reentry case managers in 2026, and 1 FTE reentry case manager in 2027. The expansion also includes providing cognitive groups utilizing the evidence-based curriculum from the University of Cincinnati's Correction Institute that we offer in Rebuilding Reentrance in Reading. Over the last 7 years, we have demonstrated the positive effect this curriculum has not only on the individual's successes and stability in the workplace, but also on their ability to make better decisions, keeping them from recidivating. We feel strongly that having the ability to offer this program to individuals prior to their release will help them change their thinking so that it will not fall back into old behaviors and lead to them recidivating. Our plan is to offer the group in 8-week cohorts with 10 individuals per cohort, offering 12 cohorts per year per facilitator. We also have a phased approach for implementation of this as well. We're proposing to add 1 FTE group facilitator in 2025 and the second in 2027.
While the numbers served in the programs we have discussed are impressive, it's the stories of impact on individual lives that can really tell the story of success. For individuals involved in these programs, what does success look like? Success looks like Daniel, whose involvement in the justice system was many years ago. He was recently hired as an auto mechanic, but because he had been out of work for a while, he could not afford the cost of boots and work clothes that he would need in order to report to work the next day. He came into Connections Work, and the Reentry Resource Center was able to provide him with the work boots and clothing he needed to start his job. Success also looks like Pedro, who's a client in our Working Toward Change program at the jail. Pedro went into the disciplinary unit for a period of time, and when he was back in general population, spoke with his case manager about the fact that he knew he needed to change his thought processes as he was continually getting himself in trouble. Since that time, Pedro has been meeting with his case manager weekly, engaging in our classes, and working on his success plan. Our case manager is utilizing cognitive intervention concepts in their interactions with Pedro. His acknowledgement of how his thoughts had been driving his problematic behaviors and his desire to change that highlights the need for the ability to deliver the cognitive curriculum we discussed earlier. Success also looks like Missy, who came into our office for help finding a job. She had manufacturing work experience from many years ago, but found that her justice involvement was getting in the way of her landing a good job. Missy became part of Reentry Works, and after completing program components, we were able to connect her with one of our partner manufacturing employers who hired her right away. Missy lives several miles from her closest bus stop. Her commute to and from work each day was long and tiring. We were able to provide Missy with a bicycle that had been donated to us for this very purpose. Her commute to work now is quicker, much less stressful. She's doing great on her job, got a raise, and is now in line for a promotion to a supervisory position. Tanya, who came to the Reentry Resource Center, was struggling and had nowhere else to turn. She had run out of her psych meds and was in a crisis. Providers she had contacted were scheduled out for months, and she could not get an appointment to get her medicine refilled. We were able to use our community connections to get Tanya an appointment the next day at a clinic where she was able to meet with a doctor, get an updated prescription, and have that prescription filled right away. For the many individuals referred by the Domestic Relations Office to Reentry Works, success looks like stable employment and the ability to comply with support payments rather than serving jail time. I could go on and on with examples of the impact of having this breadth of services available for this very needy population and their families. The programs we have discussed here today provide opportunities for success that would not be achieved by these individuals on their own.
Now we'll move on to what I'm sure you're most interested in hearing. What is the county's investment to sustain these transformative programs for the benefits of our clients, their families, and the community at large? Over the past 3 years, we have demonstrated the critical need and demand for our Reentry Resource Center and Reentry Works programs while operating them at no cost to the county. These two critical components of our coordinated system of reentry services are in danger of ceasing to exist if no funding is secured. Our request today is to approve a contract that would allow Connections Work to ensure our ability to continue to offer our coordinated system of reentry services by including it as a line item in the county's budget, guaranteeing that its fate is not at risk based on the availability and timing of grant funds. Please know that we remain committed to seeking additional funding sources to reduce the county's investment, as demonstrated by our efforts with the Rebuilding Reentrance and Reading program. Since we began contracting for R3 in 2020, the county has not been responsible for covering its full cost. In fact, we're not coming to the table empty-handed. We have already secured a total of $800,000 in new funding to support the Reentry Resource Center and Reentry Works programs. The Why Missing Foundation has committed to providing us with $50,000 to use to support these initiatives in 2025. We also were selected by Chrissy Houlihan to receive a community project funding grant for $750,000 to support the Reentry Resource Center and Reentry Works for 12 months. We are in the final stages of the approval process and anticipate receiving the funds in the fourth quarter of 2025. We're providing you with a 3-year forecast so you can see the investment to not only sustain the Reentry Resource Center and Reentry Works, but also accommodate the expansion of the Working Towards Change program, which will allow us to serve a broader segment of the jail population prior to their release so that more people will be better prepared and more successful in their reintegration. We have indicated the total program cost and included funding that has already been secured to offset the county's investment so that you can clearly see the total amount of new funding that we are requested from the county. I would like to note that the line directly above total new funding requested from the county represents the total of our contracts with the county and the United Way to fund our Working Towards Change program in its current form. For 2024, the United Way contributed $109,220, and the county contributed $183,354. This program has been collaboratively funded for more than a decade, and we are confident the funding will continue for the program at this level over the next 3 years. As I mentioned earlier, based on what we have seen regarding the timing of the past community project funding grants, the funding is typically released to the organization in the fourth quarter. With this knowledge, we allocated a quarter of the funds to be used in 2025 and the remaining 3/4 of the funds to be used in 2026. The $128,699 represents the remainder of the 3-year grant from the United Way to support the Reentry Works program in 2025. So the total new funding requested from the county in 2025 is $703,101, and in 2026 it's $633,215, and in 27 it would be $1,353,983. As stated earlier, we will continue to seek additional funding opportunities to offset the county's investment in 27. We understand and can appreciate that 2025 is a very tough budget year for the county. So we would also like to present you with an option that would allow us to continue the Reentry Resource Center and Reentry Works while maintaining Working Towards Change at its current capacity with no planned expansion at this time. Clicking. There it goes. You can see that approving this option would reduce the total new funding requested from the county in 2025 to $457,115. And in 2026, it would be $280,406 and $879,251 in 2027. We acknowledge when you look at the graphic, you may be taken back by the large increase from 26 to 27. This is only because we have not had the opportunity to secure funding for that year. As mentioned earlier, we remain committed to securing additional funding to offset the county's investment and have a proven track record of doing just that.
In closing, I would just like to say thank you very much for your time, for your attention. We know you have a lot of very hard decisions to make during the budget process this year. We come as trusted partners, good stewards of the county's current investment in reentry programs. The second option that Nikki presented allows us to continue Reentry Works and the Reentry Resource Center, two programs that have had a significant impact on thousands of Berks Countyans over the last 3 years. Soon after we began providing reentry services in the jail in 2010, it became apparent that there were many individuals in Berks County with justice involvement who were seeking opportunities and help to better their lives. Due to funding constraints, our program focus was narrow, and each day we turned away more individuals than we served. Our long-term goal, shaped by this, was to be able to meet these needs. Reentry Works and the Reentry Resource Center were designed to meet these needs. The last 3 years operating these programs has shown us we were right on target. There are thousands of individuals who have sought services from these programs who would have had nowhere to turn. While justice involvement is the common thread among those we serve, the barriers faced by the justice involved go far beyond their criminal record. These programs provide important connections to education for those with limited English proficiency and those seeking a GED. They provide connections to treatment for those with substance use and mental health challenges, and they provide connections to basic needs for those living in poverty, which is the largest segment of our population's financial status. While we have been able to secure a significant amount of money to support these programs, as Nikki mentioned, due to the uncertainty and the timing of receiving the funds, if we are not approved for the additional county support, the Reentry Resource Center and Reentry Works programs will end after the first quarter of 2025. We do not want to see the availability of these essential services removed from an at-risk, vulnerable population. Pausing these services would have a negative impact on the population, and the program restart would be delayed due to needing to start from the ground up when our community project funding is received at the end of 2025. Approving this funding request will ensure an uninterrupted continuation in Berks County's reentry services. That's what we have.
Thank you very much, Peggy and Nikki. Thank you, Warden. I'm going to make some comments and some questions. I'm guessing my colleagues may have some comments as well. So Warden, if you want to jump back up to the podium so you're there as well. I want to start by recognizing what you've alluded to. There is a long-term relationship between the County of Berks and Connections Work, the new name, BCPS, back to 2010 with the reentry program. I don't know the exact order, but I think that out of the reentry program, one of the next big things was the career fair that you continually put on. Highly successful. I have the blessing of being able to have been here and see the reentry program begin, see you move and adjust when the reentry program was moved from what the youth detention center historically back up into the jail and being able to continue that programming. Then to see the rise of the R3 trades training program, which has had great success. And this really grew out of the reentry simulation. I think you alluded to that, Warden.
Yes, sir.
A number of us, I think all three commissioners participated, a number of departments participated. That was very eye-opening. And the recognition that there's some things that have to change. I credit the warden. He's highlighted some of the things that they've already tackled that came directly out of that experience. I think the challenge that we're facing, and I don't have an answer, I will tell you, I support your organization. I support the concept that you're putting forward today, that you presented, I think, earlier to the individually to us as commissioners, if not fully in support of the program. The challenge that we face, and I don't have an answer today, is that we have some serious financial headwinds that we are moving into in 2025. And where we can, we need to save money, we need to cut costs. And I think we have to look at this and really have some detailed answers in where's the saving side of this. And I say that cautiously because I understand the human component. When I say understand, I understand it to the extent that it's possible for someone that has not fully experienced it myself to understand it. And I see the value, but I think from a standpoint of presenting this in a public facing, there needs to be an understanding what is the benefit. And the reason I bring that up, when you look at core county services, we raise about 165, 167 million in property tax. 160. It funds our core county services. A lot of people are not aware that the broad area of courts and corrections takes up a little over $100 million. Within that, you have the jail, and help me out, the jail's about 50 million. It's somewhere around 50, what's that? Yeah, right around $50 million. It's a significant cost center, and it is funded out of county property tax dollars. So when we're able to do things that measurably impact recidivism, people who are in the system, who come out, and when there are not alternatives, not in all cases, but in many cases, they go back to where they came from. And they have people chirping in their ear, hey, I got some great ways we can make some quick bucks here. And they're going through, you don't want to end up where you just ended up, but they don't have the tools to be able to make better decisions. And many of them end up coming back in to the system again and again. We've seen very solid numbers on dramatically decreasing recidivism with the reentry program that was started in 2010. Jason, I think, sends out numbers every single month on that program, who's been served, the rate of recidivism, et cetera. The R3 program, enormous positive numbers, the graduates and the percentage that recidivated. What is the percentage roughly? 5%?
5% or less.
Yeah, 5% or less of the graduates over how many years now? 7 years. 5% or less end up back in the criminal justice system of Berks County. So I need some help, not necessarily today, but pretty soon, from a jail standpoint, looking at it from the human side, but also looking at it from the dollars and cents side. What does it mean? Because right now, the financial pressures are enormous on the county going into 2025.
Sure, we can gather some data for you. We know that, I don't have the figure in front of me, but we know that it's about $150 a day to house an inmate at the Berks County Jail. So the success is them not re-entering my facility. So,
colleagues?
Excuse me. Thank you, Mr. Chairman. I have no questions. I just basically have some of the same concerns that you just stated. I want to thank Peggy, Nikki, and the warden for your great presentation. The work you do is critical and important to our county and to our society. The numbers are big, yes, they are, but I think we also need, as the chairman said, to look at the cost of not doing these things, because there is a cost. and what that cost is, both short and long term. So if we can come up with some of those numbers, I know we can't do that right away, but I would appreciate seeing that as well, because that will go a long way in, I think, helping us make our decisions.
We'll
So
work on that.
I appreciate it. Thank you.
Sure.
Yep, absolutely. So I want to thank you for the presentation as well. I support the work that you do. I think you do great work. My concern is the same as Commissioner Linebuck and Commissioner Santoni as to, where do we get this? How do we look at it? So we're going to do as much research as we can and make a decision based on that. But again, really do appreciate the work that you do. It is a great job that you do in our community, and it's for people that truly need it. So you are helping our community, those that are most in need. So thank you.
Thank you.
One of the things I would ask you to look at, both from BCPS, I did it, Connections Works standpoint, and even the jail. Historically, our relationship with Connections Work has been, they've gone after the money. They've done a very good job, not just resting on what we've provided, but getting as much, and in many cases, limiting the financial exposure of the county. Are there dollars that maybe the county and the jail might uniquely have access to that they wouldn't, that we should also look at? Before I make a decision, I want to make sure we've looked at every area of opportunity, understanding the cost benefit, but also understanding if we believe in this, just asking them to go look for additional funds, if there might be an opportunity for unique funds that are uniquely available to the county and or to the jail, that we look at that as well.
Sure. I'm wondering if there's any opportunity, and Kevin is more of the expert in this, but we can reach out to Kathy. Is there anything around the opioid settlement funds that could be used for this program?
We
sure there would
actually,
be.
we've tapped into those funds. We actually have a workforce development program specifically for people. Those funds are very much tied to an opioid use disorder. So everyone served, 100% of the people served. So the numbers that I showed you are absent, at least for reentry works, are absent individuals with an opioid use disorder, because they are already being served through some funding that COCA is providing through that.
Good.
But certainly at the jail, that there is an opportunity to look at that.
Absolutely. Anything else? Thank you very much, Nikki, Peggy. You do a great job. We appreciate it. Warden, you and Deputy Warden Smith, Stephanie Smith, and Warden Jeff Smith, really appreciate your work, and we'll continue. You have my commitment that I will continue to do everything I can to see that programs like this are able to be moved forward. And thank you for what you've done already in response to our reentry simulation experience. Thank you.
And there is a reentry simulation coming up. When is that?
Yeah, why don't you step up to the microphone, give us the details.
Yes.
Good catch.
Today, October 27th, it is going to be from 1 p.m. until 3 p.m. at Prospectus Burco. If you look at our social media or our website, there's information on how you could sign up for that. We also do have a career fair coming up on October the 7th. Is that correct? Yeah. October 7th from 9 a.m. until 12 p.m. at the DoubleTree here in Reading. So.
Very good. Commissioner Rivera, thank you for highlighting that.
Make sure people know about it. I know the last time the jail sent, JPO, APO, and different departments sent, they are also holding seats for other county employees as well. So any of the departments that have people, please want to make sure that we get them out there.
Thank you very much. That brings us to the end of our written agenda. There's no public comment in person, and there's also no public comment online.
Mr. Chairman, I make a motion, we adjourn.
Second.
The meeting stands adjourned.